Good evening, everyone. Welcome to our show today. For the next 30 minutes, you'll be hearing me talk about Beacon Therapeutic, as well as Gina Schwieger will be talking to us about Respiratory Health Association. My name is Susan Reyna-Guerrero, and I am President and CEO of Beacon Therapeutic. We represent Beacon Therapeutic. We're a not-for-profit located in the Beverly area. We've been around since 1968, and clearly our mission is to make a difference in the lives of children and families. We're creating new endings from disadvantaged beginnings, and today I'm particularly pleased because we're highlighting Respiratory Health Association, who has been a partner with Beacon for many years now, and clearly we could not do the work that we do without key partners and strategic alliances such as Respiratory Health Association. So I'm going to talk a little bit about Beacon, and then we'll start hearing about Gina and the work at Respiratory Health Association. I'm going to put some information on in terms of our 4 different locations. We have our administrative offices that are located on 103rd Street. We have our homeless and outreach services that are located on Western Avenue. And our high school location is at Calumet Park. And our Longwood campus is our elementary, houses our elementary program and our intensive outpatient program. This is a list of all of our programs, and I'll go through them very quickly. We have a Therapeutic Day School where we work with children ages K through 21. It's special education children who need additional specialized educational and supportive services outside of their traditional school program. Our Shelter Outreach Services program provides mobile mental health services to homeless women and children throughout the city of Chicago. We have a CHIP program that's enrolling children into insurance programs that they're eligible for. We offer early Head Start programming where we're really targeting homeless and at-risk children ages 0 to 3. Our FACT program, which is an evidence-based initiative working with young mothers and their children, particularly focused on homeless young mothers or vulnerably housed young mothers. Our Homes program is targeting the most at-risk families and helping them move to stability and housing. We have a PATH program that targets severely mentally ill mothers and families. We have intensive outpatient programs that work to stabilize children so that they don't move into a more restrictive setting. And then we have a traditional outpatient mental health program that really works with community individuals that need mental health services. So today I'm really excited because I have Gina Schwieger with us from Respiratory Health Association, and we're going to be talking about an event that's coming up, the Skyline Plunge, which I'm going to be taking part in as well, and we'll show some pictures about that. But Gina, welcome to the show. Thank you for being here. The next 30 minutes we'll be talking about this. It is a live call-in show, so please, if you have any questions or comments, don't hesitate to give us a call. Number is 312-738-1060. So Gina, welcome.
Thank you for having me.
And tell me a little bit about yourself.
Sure. I have been at the Respiratory Health Association for the past 14 years. I oversee a great team of special event professionals, and we really do our fundraising through special events and other means.
You know, and one thing to give a little bit of background in terms of how we got involved with the Respiratory Health Association. We, of course, were always looking for strategic partnerships and alliances, and particularly we were fortunate enough to receive a grant through Respiratory Health Association. Right. And I've always talked about it was one of the best grants ever because it was easy to work with the team. I think we work with many great teams, but clearly your team, they were vibrant, they were energetic, they were creative, and it was a great initiative for us. It was through the Chicago Tobacco Prevention Project, and through that we were successfully able to implement a myriad of smoking cessation programs. Both the agency became smoke-free. Right. Our health educator did all kinds of work with our adolescents, with our homeless moms, dovetailing in a little bit in terms of the mental health arena, which has a high smoking incidence of smoking and so on. So it was a great relationship. So tell me a little bit about Respiratory Health Association and what is their mission?
Absolutely. Our mission is to promote healthy lungs, and we do our work through work of education, advocacy, and research. We've been a non-for-profit in the West Loop since the early 1900s, and as you got a chance to meet our programmatic team, I happen to be on the special events staff. So really, we've been a public lung health leader in the city for a really long time, and our approach is comprehensive, and the work that we do has to do with anti-tobacco, COPD, asthma, and environmental issues.
And I'm going to put your contact information on because I think it's important. You're right in the West Loop, right? Is that considered the West
Indeed.
Loop? And I think you've described 3 really important things. You mentioned COPD, smoking, and just lung health.
Yeah, asthma, COPD, environmental issues, and anti-tobacco.
So tell me a little bit about some of the statistics associated with these illnesses and diseases that you speak of.
Absolutely. Well, you obviously came to know us through the tobacco grant. Did you know that more than 36,000 teenagers in the state of Illinois begin smoking each year? That's a statistic that we are trying to combat. The asthma hospitalization rate is very high in the city of Chicago. And so we do a lot of work where we are trying to train young students and young people how to manage their asthma effectively. Also, lung cancer is one of the leading causes of death, especially in women. And so we are trying to add more research funding towards our lung cancer initiatives. COPD, chronic obstructive pulmonary disease, is actually the third leading cause of death and disability. That disease is often affiliated with those who have been long-term smokers. Those are some of the work that we do.
I mean, and clearly, the items you described, I'm thinking I was touched by each one of those things that you just described. Had a good friend that died of asthma. And then my mother, and we'll talk a little bit about what's motivated me to do the plunge, she had COPD, which we weren't aware of. And then she died of lung cancer after never having smoked a day in her life. So that kind of is a good segue into the event.
For sure.
So tell me a little bit about some of the myriad of events RHA does, because you guys this is the plunge we're going to talk about, but there's some other neat stuff.
There are. Many people know us by a very popular event called Hustle Up the Hancock. That's the event that happens on the other side of town over at the John Hancock Center. That is where people climb up the building. Skyline Plunge, which we're going to touch on, is an event for which you can rappel down. But we also have other events that include a 3-day bike ride called Cowalunga. We have a family-friendly walk event called the Hike for Lung Health. We have social events that include dining and wining. Those are called Chill and other events. We also have a running team, whether it be with the Chicago Marathon or a race of your choice. So many different events that involve depending on what people's level of interest is.
So you're describing like a lot of things on the ground, and then you're also describing going up the Hancock. So what is the Skyline Plunge?
This is one of our newest events. In 2009,
and I'm gonna put some information on.
Please.
Okay.
In 2009, we decided to add and expand our special events. And so we partnered with a company out of Canada called Over the Edge, and they're an industrial rope company that teams up with non-for-profits in North America, and they produce these type of fundraising events. So we fortunately hold the exclusive contract in the Chicagoland area, and this, quite frankly, is an urban rappel adventure for which you, Susan, are going to take part in.
I know, and I was looking at the pictures and like, oh goodness, what am I doing? But okay, so I'm going to put up another picture, which I think is really interesting. Because, okay, so it's at the WIT, and you're going down 27 stories.
It is. So here we are under the beautiful skies at the WIT Hotel, 201 North State Street. It's right at the corner of North and State. It's 278 feet, 27 stories. We like to say 27 stories and one great story to tell.
Yeah, well, this will be, and I think this picture here, I was like, my drill instructor said, you realize, Susan, you're going to have to walk off backwards. And I know you just demonstrated it outside. So you actually did this.
I have. Finally, I did it. I, too, felt sort of that bucket list compulsion to want to do this event. I also wanted to be able to understand what each of our event participants were experiencing. So finally last fall, I was a participant in Skyline Plunge. So I, yes, stepped over the edge, 278 feet above the Chicago skyline, took in the gorgeous views, got excited, and yes, got a little nervous, and did the plunge.
And so how do you raise funds for this? So, I mean, obviously it's a great adventure.
It
but
is.
Then what's the win? Where's the fundraising come in?
Sure. So there is a registration fee, and then there is a fundraising commitment that each plunge participant commits to. It is a minimum of $1,000, and we give you several weeks, if not months, to raise that. Each person is provided with a professional fundraising coach, someone out of our office on our special events team, to help you raise the money through your personal network and outreach efforts, through a personalized fundraising page, and It is an ability to do it safely, securely, and privately on a secure website.
So I'm going to put actually my information on because I am still looking for pledge supporters. Now, one thing for us, and I was very fortunate that we were able to do this, is that it's kind of a win-win for Beacon and for Respiratory Health Association, in that, you know, I met the target goal, and then we're hoping that as a result of this, then there will be a grant that we will able to get to continue the health-related work that we've been doing at Beacon. So it's kind of a win-win. I raised actually my goal. My first goal was $2,000. 2,000, and then I raised it to 2,500, and right now I'm about 2,600.
Congratulations, that's fantastic. Those are what we're looking for. I think currently you may be in our top 5.
Woohoo!
So that's great. We want to always encourage people to continue raising, so I'm glad that you're sharing that with your viewing audience today.
Yeah, so hopefully I can reach 3,000. And you know, one of the things, and I'll do this quickly, is what's motivating me is my mom. So she passed away from lung cancer a year ago, February. Never smoked, had COPD, which we weren't aware of. And one thing that I think I really get from her is her sense of adventure. So I think even though, as I jokingly said before, she probably would be praying the rosary down at the bottom for me, she would be thrilled that I'm doing that. So that's obviously, she worked as a nursery nurse and extremely giving, always helped those that were needy and so on. So she worked as a nursery nurse. That was when she was younger. And then this is her wild sense of adventure, her and my dad in New York on top of the Empire State Building.
That's fantastic.
That was a great picture. So tell me a little bit more about what happens the day of the event and how that works.
Well, first I have to say, Susan, you're not alone in your reasons or your motivations to wanting to do Skyline Plunge. More than 70% of those who participate in an event like this are doing it, frankly, to honor someone that they've loved or in memory of someone who's been touched by lung disease. So on event day on May 5th, you will be surrounded by those who have a similar feeling as to you, those who have a loved one, and someone that you're doing it in honor of. So
how many people will actually, now there's 2 days of this, right? There's I know it's May 5th, and I have my time, it's at 10:30. So that's
Susan, when you will take the plunge. Yes. Exactly. You will go over the edge and complete your plunge. So on Saturday is just our media day. Certainly spectators are welcome to come out between 1 and 4. But Sunday is really the big day. That's the day on May 5th from between like 9 and 5 is when we expect about 75 to 80 people will participate in Skyline Plunge. And so there's a great viewing pedestrian median for which people can come out and view from there.
Yeah, as you're talking, I'm going to put on some of the images.
Yes.
So you're saying between 75 and 80 people. Are there still slots available? People wanted to sign up?
Absolutely. If you would like to be one of these brave, adventurous people wanting to really participate in a unique fundraising event, this is the event to join. Here's some great photos of 2 buddies, 2 friends who are both doing this to honor a loved one. This is kind of the image from the top. And you can see these gals are dressed alike. They're wearing bright colors, and they're really kind of making a memory for themselves, checking off that bucket list memory. We absolutely have spaces still available.
That's exciting. And then how long does the whole thing take about?
You know, it's about a 2-hour experience from the time you come and check in, from the time that you get trained that day on event day, and then you do your plunge. And then there's photos and congratulations and, taking off all the gear. So it's about a 2-hour approximate experience. It'll take you about anywhere from about 15 to 20 to 25 minutes to complete your rappel. Susan, it really depends how fast you rappel.
I know, and I'm wondering how I joked with the folks who sponsored me that I look forward to sharing the pictures, and I keep on thinking it'll either be of me terrified or of me like with a big giant nervous smile, because it'll be enjoyable, but at the same time kind of challenging.
By the time you get to where this person is, that is somewhat near the bottom. The first maybe 19, 20 floors, you might have that terrified face. That was at the bottom. You can see kind of in relation. That person's about maybe a story above the ground. So at that point, I think you're ready to smile, even if it's to say, oh my gosh, I'm almost on the ground.
Yeah, no, and I think I've appreciated the emails that I've been receiving recently in terms of this is what to expect. So clearly there's a lot of preparation and it's very safe.
Yeah, very much, Susan. You know, each participant, we commit as a staff member to being your personal fundraising coach. So everyone who commits to the registration fee and fundraising will receive a personal fundraising coach.
And so let me put your contact information out again, because again, if anybody is interested in doing this, you can join me. Let me put this on here again, because this is who they would contact, right? They could contact.
Absolutely.
Okay.
Absolutely. Our website is at lungschicago.org. Go to the special events tab or look for the big button for Skyline Plunge. You can register right online. It's a website that's live. We can take maybe about 15 more people. So if you're one of the brave last 15 people to get in the event, we would love to have you.
That would be exciting. So this is only something you do once a year.
We actually do it twice a year now,
okay.
Based on the demand. We'd love to be able to fill our May event. We've actually extended the fundraising date for anyone who wishes to register after April 15th. We've extended the fundraising date for them till May 31st, and then we'll be back at the Witt Hotel in September to do it all again.
Oh my goodness. Do you find that people come back and do it over and over again?
Yes. We initially thought that this would be sort of a once-in-a-lifetime experience. People want to come back a second time to be more engaged in the process. They get over their fear that first time and then decide they want to come back.
Yeah, I know. I've heard that from marathon runners. They run the first one for themselves just to know that they can do it. And then the next one, then they'll maybe do it, like, okay, now I really want to appreciate it. So I could see this happening. I don't know if I'll get addicted to this, but there you go. What are some of the more unique kind of stories you've heard from people or testimonials that you've heard from people that have done this?
For sure. This is about people honoring others. So they come with beautifully decorated maybe shirts or an image of their loved one maybe on their shirt, or they write their name with colorful tape on the back of their legs so that everyone can see them. They wear something, maybe a sock or a shirt or something of their loved one so they can kind of honor them in that way. We have a memory board that people write on before and after they do the event. This is an event that people just aspire to be a part of because of the cause and for the pure adventure. But this is an event that people will remember for a lifetime.
Well, I know when I first considered it last year when my mother was ill, I would go by higher buildings and I would count the floors to think like, okay, is that 27 stories? Is that? And then when I drove by the Witt, which is a great building, I'm like, oh, that's way taller than I thought. But, it'll be fine. It'll be fun. And I know you get to do a bit of a practice run beforehand, right?
There's training involved on event day. So you will do a 2-story training rappel practice before you go on to the 27 stories, the big Skyline Plunge.
Okay. Well, that'll be interesting. So tell me, so you described the different works of the Respiratory Health Association. Is this particular money raised from this event earmarked towards one particular arena, or it's just in general to support the broader work?
Yeah, it's in general. It supports all lung health initiatives. So whether it's our asthma initiatives, our lung cancer initiatives, COPD, environmental issues, it goes towards all of those type programs.
Now, we talk about this climate of limited resources, lack of funding. What are some of the biggest challenges that RHA is facing, or are there some thoughts on new avenues for funding, or any comment on that?
Well, we received funding through a variety of different ways. Special event fundraising is just one of the avenues for which we raise money. There's also certainly, grant funding, individual giving, those who perhaps make a memorial gift in honor of a loved one. Sometimes we receive gifts from a birthday in lieu of flowers, or to honor my birthday, send a gift that way. There's all sorts of ways that people can participate or give a donation through lungschicago.org.
So you mentioned this is the Skyline Plunge right now. You have it again in September. What are the events that happen in between? Are there other events that are happening in between?
There are, some of which we touched on. So in the summer, we will have a bike ride called the Cowalunga Bike Tour, and that's a 1, 2, or 3 day bike ride that happens from northern Illinois up until southern Wisconsin.
Oh,
About
wow.
300 fantastic, really enthusiastic bike riders will join us. Then, of course, there is the marathon or race of your choice that happens usually in the fall, or if someone wants to do a 5K or a 10K and associate their fundraising with respiratory health, that's always a good avenue. Then we go into our Hike for Lung Health. That's the family-friendly walk event that we do in
Okay.
Lincoln Park.
That's right. That's right. I've done that one actually before too. One of my colleagues is affiliated with the ARDS. I can't think-
Absolutely,
Yes.
absolutely. They're one of our charity partners. But then, if you're more interested in wining and dining, then Chill is the event for you. That happens over at the Merchandise Mart, and that's in November. So that's more about wining and dining and walking through the fantastic showrooms of the Merchandise Mart.
Oh, that sounds like fun. Well, both the Cowalunga and then that one sounds really good too. So here's your contact information. I'm going to put it up again. So that's, again, the number 312-628-0210, and then the email address is there. And then that's where they can find out more.
All of the events are listed at lungchicago.org, and that phone number, you can call me directly about any of the events that I mentioned, or I can help you register online.
Okay, well, that'll be great. So, and mindful of the time, it's 4:51. Do you have any final thoughts or comments on the plunge? Any wise words of advice for me as I'm doing this? May
Susan, we're
5th?
just glad. I'm proud of you already that you're taking this initiative. You're doing this to honor your mom, and what a great memory you're going to have. This is about making a memory for yourself. For others, it could be just an adventurous urban rappel experience. This is about checking off of a bucket list. We are absolutely holding spots for about a dozen more people, but the point is to register soon so we can help you get your fundraising started and get you assigned your rappel time the way you just did recently.
I know, so that'll be great. So I will put my information on again once more. If you wish to sponsor me, please feel free to do so. It's lungchicago.org/Susan Reyna-Guerrero, or if you go on the Beacon website, it's listed there as well. And then, so just a couple of final things. I would like to list some events that we have coming up. In addition, we have Home Run and Pizza promotion May 2nd, so that anybody who orders from Home Run and Pizza, if they mention Beacon, a portion of the day's receipts will go to Beacon. Of course, the Skyline Plunge, which is May 5th, and we'll probably have you back afterwards, and we'll show all my terrified pictures on there. We have our 14th annual Beverly Breast Run Cancer Walk, and that we're hosting in Beverly. The Ridge Run that we're hosting in Beverly as well. The Cycling Classic, it's in July, which we host on Beacon's grounds. And then our Beacon Bash, which is raising funds for our homeless program, and that will be at Joe's on Weed Street, July 25th, and we'll be having more information on that as well. So I'd like to thank you today for being with us, Gina, and I look forward to seeing you May 5th. That'll be fun. And I'm thinking now what I will wear, and I will wear all purple because that was my mother's favorite color.
Perfect.
And maybe I think I will put my name on, her name on my leg so you can see. It'll be like, hi, Mom.
Colored electrical tape or all that fun duct tape works really well. There's a little tip for you.
I'll do that. And hopefully I'll have a cheering crowd there, because I think once I get down, either I will be sobbing with emotion or I'll be like all nervous. So we'll see how it goes.
We invite people to come watch, or better yet, register and participate yourself.
That's right. It would be great that's true, to have a twosome. That way you're walking down with somebody else and you can kind of motivate each other, right? This picture.
That's
That was
right.
on
Do
there.
it with a buddy.
Do it with a
So
buddy.
have two people go and recruit someone else so you can have that experience together.
That's true. That would be fun. I think I'd have to find another brave soul friend of ours. I think I want to leave with that picture of the feet, because I'm really intrigued by it. And where is it?
That's a great aerial shot.
Yeah, of the 2 feet coming off. And I should have been better organized. Oh, where is it? It's just, oh, here it is. Okay. So I will end with this. Thank you again, Gina, for being here. And I'll see everyone next week again.
Susan, I look forward to seeing you, and welcome to Skyline Plunge. Can't wait to see you complete it.
Oh, it'll be fun. Thank you.